What I want to talk to you about is the importance of exercise and staying active in pulmonary hypertension. So I'm not talking about marathon running or powerlifting or being really massively over the top active. We're talking about gentle exercise, the right kind of exercise, and ways to build more activity into your daily life and how that can make you feel more well when you're living with your pulmonary hypertension. And we know that exercise is important for patients with pulmonary hypertension, and there's been research that's been done that shows the benefits of exercise. And two big things come out of the research that are really important to hear. So the first thing is that exercising for patients with pulmonary hypertension is safe. So in the studies that have been done around exercise, there have been no serious events, there's been no major problems. The patients who have been exercising haven't become more unwell as a result of the exercise. With the right kind of supervision, with the right kind of advice and doing the right kind of exercise, it is safe for people with pulmonary hypertension to exercise. And the other thing that we know about it is that patients with pulmonary hypertension can benefit from exercise and can feel better for it. So that benefit might come in the form of being able to walk a bit further, or it might be that there are things that you can do that you didn't used to be able to. Or it might be that you can do the same things that you used to be able to do, but you feel less exhausted at the end of doing them, and you can fit one or two more other things into your day or into your week. And generally, people who have undertaken exercise and got a bit fitter with pulmonary hypertension talk about how it's improved their quality of life. There are loads of other benefits from exercise. It can improve your social activity, it can get you out of the house, it can have a positive impact on mood, it can be helpful for people who suffer from anxiety or depression. You can exercise with other people, and also there are obviously benefits around weight loss from exercising as well. So it's not just me saying that exercise is a good idea, and we're not saying that you should exercise just because the research tells us that that's the case, but what we see is lots of patients who have become more active, who have built exercise into their lives, and when we see them back in clinic and when we talk to them, they tell us about how much better they feel for it and about what a difference it's made to them. When people with pulmonary hypertension are exercising, what we're not saying is that it's changing the pulmonary hypertension. It's not changing the disease, it's not reversing the disease process within your body. What it is doing is it's getting you a little bit fitter and a little bit stronger. And what that does is it means that living with pulmonary hypertension and dealing with it day to day is much easier. We also know, because lots of patients have their symptoms for a very long time often before they get diagnosed, it might be 2-3 years of being a little bit more breathless and a little bit more breathless again and then more breathless again. And during that time, people will do less because it's difficult to, and then they'll do a little bit less, and then they'll do a little bit less. And throughout all of that time, people are losing their strength and they're losing their fitness because they're doing less, so their legs become a bit weaker, they get out of shape a little bit. And so by starting to exercise and starting to get more active, you can reverse that deconditioning effect, that weakening effect, build up your strength, build up your fitness again, which makes living with your pulmonary hypertension a bit easier and gets you in the best shape you can be to live with your condition going forward. What we're not talking about here also is a short-term change or a quick burst of exercise. I know what I'll do, I'll join the gym for 3 months and then that will make everything better. It's important to start to think of this as a lifestyle change, something that you're going to be doing in the long run, in the ongoing period. So by making small, manageable changes to your life, bit by bit, step by step, and integrating this into how you live your life, being more active and exercising and making these changes that last and endure. So if we're talking about being more active or exercising more, what can you do about it? What are the changes that you can make? I think the first important step is to understand where you are at the moment. When we see people, they tend to fall into one of 3 different categories. The first, people who are exercising. The second, people who are active but not exercising. And the third, people who are sedentary or doing a lot less. So people who are exercising might already be a member of a gym and go from time to time or more regularly. They might have some exercise equipment at home, like a running machine or a cycle that they go on, or some weights at home. They might go for long walks regularly. They might cycle or swim on a regular basis. People who are active and not exercising are people who are out and about. So they would go to the shops, they might do some light housework, they might pot around the garden, and they can generally fulfill most of their normal day-to-day activities. But they're not doing anything which would fall particularly into the category of exercise specifically. And the third group of people who are more sedentary. So these people might be mostly based in the house. If they go out, they would mostly go in the car and only walk the short distances from the house to the car, or from the car into a shop or into a cafe or something like that. So these people are doing a lot less and at a much lower level of activity. So what you need to do is to decide which of those three groups, exercising, active, not exercising, or sedentary, you fall into, because the changes you're going to make are going to be different according to which group you fall into.